name is Sarah Hickey. I'm your nurse today. How are you doing?
Good.
Good. Can you tell me your name?
Dennis Hickey.
Dennis Hickey. Can you tell me your date of birth?
July 13th, 1966.
Do you know what today is?
It's May 21st, Thursday.
Do you know where you're at?
Waco Hospital.
Do you know who the President of the United States is?
Donald Trump.
Good, good. I've come in to do a head-to-toe assessment on you to see if we can find anything going on with you, see if we can find any abnormality. I noticed on your chart that you have a sore throat, so let me check your name badge to make sure it did match. Yes, you are Dennis Hickey, May 7/13/1966. Okay, the first thing that I'm going to check is your eyes. Look at my finger. They are both round, and they are both reacted to light. They are both symmetrical. They're equal to one another. There is no redness or drainage. Can you follow? In good control, good eye control, movement. Do your ears hurt? You have any headache?
No.
Ringing?
No.
Very good. Well, the skin in there is pink and moist. I didn't see any open areas or lesions or anything. Let me check your nose. Very good, very good. I don't see any drainage in there. I don't see any redness. Your throat is soft. Does that hurt when I touch there?
No.
Okay, and it's symmetrical, it's equal, and there's no pain there. Open your mouth for me. The skin inside the mouth is moist, no lesions or blisters. There is some slight redness on the back area of the throat, and the teeth are intact, and there are no reddened areas. There are some tooth cavities in there, tooth caps it looks like. You've been to the dentist?
Yes.
Very good. All right. The first thing that I'm going to do is I'm going to check your arms to make sure your arms are working good, okay? So I'm going to start on your left side and move your arm up. Does that hurt when I do that?
It does not.
Does not hurt. Does it hurt when I touch in these areas?
No.
Okay, there's no edema, no inflammation, no pain. And check the right side and do the same thing. Does that hurt when I do that?
No.
Okay, does it hurt when I touch on it?
No.
Okay, there is no edema, no poor range of motion. Can you squeeze my fingers? Very good. Can you push against my hand? Very good. Grip is equal. Strength is good. I'm going to check skin turgor. Skin turgor is good. The skin drops down fast without standing. And now I'm going to check cap refill. It's less than 3 seconds, which is good. And I don't see any opened areas, redness. Skin looks intact, and it's warm. So now I'm going to move to the apical pulse, which is going to be measured on the left side, mid clavicle, first intercostal space, which is one finger. And listen for 1 minute. The normal range is between 60 and 100. And so I'm listening for 1 minute. It's strong, regular, no abnormality sound noted. Are you having any chest pain, difficulty breathing?
No.
Okay. So now I'm going to start on the left side and listen to the lungs. There are 7 anterior positions that I listen to, and there are 10 posterior positions that I listen to on the lungs. And what I'm looking for is abnormality sounds or diminished sounds or unequal sounds between the right and the left side. The abnormal sounds that I'm listening for are wheezing, crackling, stridor, rhonchi, and in my assessment, the areas of the lungs that I'm listening to are the bronchial, vesicular, and bronchial-vesicular area of the lungs. So I'm going to start on the left side, mid-clavicle, second intercostal space, and I'm going to listen as he inhales and exhales. Lung sound is clear. I'm going to move to the right side. Lung sound is clear, equal, non-diminished. I'm gonna go down a little for the third space. It is clear, no changes. I'm gonna move over to the left side. It is equal, clear. I'm gonna move to my fifth spot. It's clear. I'm gonna move to my sixth spot on the right side underneath the nipple, and it's clear. And the C swerve up for my seventh spot, and it's clear. The anterior of the lungs are clear, non-diminished, and equal, symmetrical. So I'm going to listen to the back side, making sure that my drum is touching the skin. And I'm going to start on the left side, watching, make sure that I'm not hitting the spine, as well as the scapular of the back. So I'm going to start on the left side, listen for the sounds, so I can identify air exchange in the bronchial. Clear. Clear on the right side, down 1 for 3. Clear and equal. Clear, normal sounds. I'm going to go to number 4 slot. Clear, non-diminished. I'm going to go to 6. Clear. I'm going to go to 7. Working my way outwards underneath the scapular. There's 8. We're going to go out to the side just slightly. Clear. Clear. All lungs are clear, non-diminished, and symmetrical. If there is a little bit of abnormality that I might hear, I would ask the patient to cough. Can you cough for me, sir? And I would reassess my lung sounds. Okay, we can pull up your clothes. Have you had any nausea, vomiting, or diarrhea?
No, I have not.
Okay. I'm going to lay you back and listen to your abdomen. I'm also going to palpate to see if there's any tenderness in the area. And I'm also going to assess the size of it, the shape of it. As you can see, it's slightly round, it's non-distended, and does that hurt when I touch on it?
No.
And it is non-tender. As I assess the skin doing my lungs as well as my abdomen, I check the skin to make sure that there's no skin integrity issues, and I do not see any. The skin is warm, dry, and intact, and moist. So now I'm going to listen to the abdomen, and there's 4 quadrants to listen to, and I'm listening to the hyper or hypo, normal, or absent sounds. If the sounds are absent, I'm going to call the doctor immediately. Bowel sounds are normal in upper quadrants, right and left. I'm on the left lower, and it's normal. And I'm on the right lower quadrant, and it's normal. Any problems going to the bathroom, burning?
No.
Okay. Difficulty voiding, if any. Okay. So now I'm going to assess the lower extremities, feeling at the hips. Let me move this for a minute. Do you mind if I move your blanket?
That looks good.
Okay, great. So I'm going to be touching his hips. Does that hurt?
No.
All right, I'm going to move down his legs, checking for pain. Does that hurt anywheres?
No.
Okay. I'm going to check his sensations of his extremities. Can you hold your hands out just like so? And tell me which side that I'm touching.
Left side.
Correct?
Left side.
Correct?
Right side.
His upper extremity sensation is good?
Left side.
Correct?
Right side.
Correct?
Right side.
Correct. His lower sensation is good. I'm going to do some range of motion. Does that hurt when I do that?
No.
Range of motion is good. On the right lower extremity, on the left lower extremity, does that hurt?
No.
Okay. Range of motion is good. Skin is intact. There is no discoloration, no lesions. Skin is moist, warm. So I'm going to feel the tibular and the dorsal pulse. checking for strength, and they're both present, and they're equal, and they're strong on the tubular, and then on the dorsal pulse. They're equal and strong and regular. All of them are. Just as up here. They're equal. And these are the radio pulses. Strong and regular. Alright, I'm going to check his skin turgor down low. And skin turgor is good. No edema in anywheres. Capillary refill is good. The skin turgor was good because the skin repositioned itself very quickly. And on the capillary refill, the skin, the coloration to the skin returned back with less than 3 seconds. No pain or anything. So, and that would be the assessment, head to toe assessment. Thank you very much. We're going to sit up. And, all right, Mr. Hickey, the doctor has ordered you some antibiotic for your sore throat. The antibiotic that he ordered is Cipro. It's to be given to you by mouth twice a day for 10 days. What you're going to watch for are some side effects: nausea, diarrhea, difficulty breathing, or rashes, or worsening of your sore throat. The worsening of your sore throat means that the antibiotic is not working effective, and we'll need you to call back up here so we can get you something different. For the pain, we'll give you some Tylenol every 6 hours. Also, you can gargle with salt water, and make sure you avoid hot foods. Can you tell me what antibiotic the doctor ordered for you?
Cipro.
Can you tell me how many times a day you're to take it?
2 times.
Can you tell me how long? How many days in a row?
10 days.
Okay. Can you tell me some side effects to watch for?
Worsening of the sore throat.
That's what you'll come back up here on. What are some side effects of the actual medication?
Vomiting.
Mm-hmm. Itching.
Itching.
Diarrhea.
Diarrhea.
Okay. You'll call back up here on those signs too, okay?
Okay.
Can you tell me what you could do for to help with the pain?
Gargle with salt water and take Tylenol.
Okay, do you know anything? Have you taken Tylenol before?
Yes.
Okay, are you allergic to anything?
No.
Okay. All right. Well, we'll get you on your way and get your script to you. You have a good day, and I hope you get to feeling better.
Thank you.